Welcome back, everyone. Cannabis Partners, Canada Newsbreak. Piggybacking off an earlier post we did about mental health and anxiety and depression with cannabis, comes this news out of Utah that Men's Tribal House. It's a sober living home where recently incarcerated people use medical cannabis to help in their recovery from drug addiction, et cetera, that led them to those crimes. One of the residents here, Joshua Kyle, said, "I would either be in prison or I'd be dead. I know that for a fact." He lives at and manages Men's Tribal House after struggling with heroin addiction for 20 plus years. He said his mother would lay awake every night waiting for the phone call that her son was dead during his years during addiction. He now has a legal card that allows him to use medical cannabis to help him stay in recovery. He says, "Instead of me going out and picking up a needle and sticking it in my arm, I pick up a vaporizer or I pick up a cartridge or I pop a gum in my mouth and it gets me through the day." And he's been off opioids for quite some time. Shane Erickson, who owns the Men's Tribal House, says medical cannabis maintenance has proven to be a harm reduction tool to treat things like chronic pain and PTSD, and is actually helping people at sober homes stay off the opioids that landed them there in the first place. So again, we've said it countless times. We have an opioid problem in the U.S. No one debates that fact, and time after time again, we find people are able to substitute a plant for that drug, whether it be prescription medicine, whether it be cocaine, whether it be heroin. They are able to stop the use of those opioids by replacing it with this plant. Although it's kind of a weird, in Utah, it is illegal to light cannabis on fire in Utah. So none of these people are able to smoke a joint or a bowl. They have to either buy a vape pen and vaporize it, or they consume it in gummies. But they can't actually light it on fire, which is kind of odd. So Erickson owns the house, says that the cannabis calms the body and mind and prevents relapse, especially when hard times come up. He goes, they just don't run down the block and get heroin, Erickson said. So this is a great thing. I think, there's not a lot of this out there right now, but, we like making predictions here at Cannabis Partners about cannabis. So I predict this becomes a mega trend. I already know of people in clinics in Massachusetts who are trying to substitute cannabis for methadone for withdrawal symptoms. They claim it makes the withdrawal symptoms manageable. Methadone has its own problems, right? It's basically you're substituting one opioid for another. But cannabis does not have those side effects or those problems. And if you talk to people in the rehab industry, they will tell you that cannabis is proving to be a miracle plant to helping people navigate and not just get off the opioids, but stay off, right? The big trouble with addiction is, yes, you clear it up, but then it comes back, whether it be a month, 6 months, 6 years later. The cannabis is allowing people to stay off it and stay off it for prolonged periods of times without relapse. So we're going to say here at Cannabis, not a couple years ago, early last year during the COVID epidemic, we predicted that by the end of this year, 2021, over half the states in the U.S. would either be in the process of legalizing or would have legalized cannabis at an adult use level. And I think we're pretty much well on our way to having that number met by the end of 2021. And I think the next thing is you're going to see more and more treatment facilities across the U.S. Utilizing cannabis or medical cannabis for their addiction support services. And it's going to become a much more prevalent trend. So, and based on, it's anecdotal evidence, what we've heard, what we've seen, we think it's going to be a really helpful thing for the addicts and then for society at large. So keep an eye on that one because I think it's going to be something you hear a lot more about. Thanks and have a great day.